Imagine being in a hospital or an outpatient therapy clinic for a period of time, and then imagine being exposed to therapy in a natural environment where there's fences to climb, outdoor obstacle courses, and apple trees to pick from. With therapy in a natural environment, one will be exposed to auditory, visual, and olfactory stimuli. Receiving therapy in a natural setting allows clients to feel free where they can benefit from the surroundings of a fully functioning barn. By being in an inclusive environment with typical peers, this is allowing the clients to experience therapy in a different way than conventional therapy. According to the American Hippotherapy Association, the term hippotherapy refers to how occupational therapy, physical therapy, and speech-language pathology professionals use evidence-based practice and clinical reasoning in the purposeful manipulation of equine movement to engage sensory, neuromotor, and cognitive systems to achieve functional outcomes. Hippotherapy is not in its own category, and there is no such thing as a hippotherapist. Instead, it is part of a patient's integrated plan of care that uses other treatment strategies in combination with the affordances of the equine environment. Hippotherapy should not be confused with therapeutic riding, as hippotherapy is a medically based treatment tool that can oftentimes be reimbursable by insurance, whereas therapeutic riding is considered a recreational activity that involves teaching individuals with disabilities equestrian skills. The equine movement provides a sensory motor experience that involves a precise, rhythmic, repetitive pattern of movement that is extremely similar to the pattern of an individual's pelvis during normal human gait. The three-dimensional gait pattern exerted by the horse addresses impairments of tone, range of motion, timing, attention, arousal, coordination, balance, and postural control. The horse provides a client with anterior, posterior, lateral, and rotational movement. With lateral movement, side sitting is shown here. It promotes lateral weight shifting, trunk flexion and extension, and helps clients tolerate a different visual orientation. As you can see, backward sitting helps facilitate anterior-posterior pelvic movement, as well as concussive weight bearing on the arms, which helps promote strength in the shoulders. Utilizing the position of forward sitting, it helps the client become acclimated and comfortable on the horse, while also promoting the hips to move in a typical gait pattern. A physical therapist can add in turns by having the horse move in a serpentine motion to work on lengthening or shortening the torso. While in this position, having the horse make abrupt stops and going forward again can foster typical balance reactions to the client. According to Citizen Diem, entrainment in the biomusicological sense refers to the synchronization of organisms to an external rhythm, usually produced by another organism with whom they interact socially. Seong-Gil Kim and Shea-Woo Lee wrote an article looking at 22 elderly persons residing in a local community. The subjects were divided into two groups, 11 who received hippotherapy treatment and 11 who received treadmill exercising only. This research article showed larger improvements regarding static balance in the hippotherapy group, specifically stating, "Therefore, we conclude that both groups gained improvements in static balance, with the hippotherapy group showing larger effects."
Well, that has made me improve my overall balance from my head injury. In my life, I'm more able to get around without falling.
Park, Ra, Shin, Kim, and Young conducted a study on 34 children with spastic cerebral palsy who underwent hippotherapy for 8 weeks. After the 8 weeks, this research article showed significant improvements, specifically in the sitting and crawling as well as kneeling categories of the GMFM 66 and GMFM 88. Additionally, this article said the improvements in the GMFM 66 were significantly greater in the hippotherapy group than in the control group.
Yeah. Okay, push the button, Kate.
Good job, Katie.
When we first started, she was more aware of what her surroundings and more involved in things and more expressive after she would ride and do hippotherapy. I think the gait of the horse kind of stimulates your body and to allow her to feel that movement, to stimulate all her muscles. And in physical therapy with the horse as a tool, the gait of the horse represents the gait of a person walking, so it's more stimulating, it's more input into the body, and it's more beneficial in my opinion.
A systematic review conducted by Atun Eni and Lotan found that hippotherapy is an effective treatment tool that benefits children with autism spectrum disorder, specifically referring to gross motor, sensory, social and behavioral, adaptive, and postural aspects. In this study, Atun Eni and Lotan explained that the positive results in postural and social and behavioral aspects were due to the multidisciplinary nature of hippotherapy, which physically challenges and stimulates the client. Additionally, they explained that the safe physical presence, warmth, and natural rhythmic and continuous movement of the horse contributes to the effectiveness that hippotherapy provides.
So yeah, and he was extremely stiff and didn't move much, didn't run, didn't climb. That was a real big thing as a child, as a toddler, not climbing. Very comfortable on the horse and sitting upright. When he gets out there, he's all of a sudden sitting upright. I think it's the incentive of the horse, for sure. Like I said, for him, the horse is very much an incentive. You know, it's like she will explain to us is how she wants him to do certain things with, you know, trying to reach and grab and put things, hoops onto poles. But if he doesn't do it right, then he's not going to run with the horse, or they're not going to move fast with the horse. And so he's learned that if I do this correctly, then I will do this.
Those with a diagnosis of autism spectrum disorder may present with symptoms such as social challenges, difficulties communicating, sensory processing troubles, and lack of coordination and balance. With that being said, a study conducted by Zenman, Standeven, and Shirtla showed significant improvements in adaptive behaviors, self-care, low-demand leisure, and social interactions in children with autism. Specifically stating, hippotherapy has a positive influence on children with autism and can be an effective treatment tool for this population.
The very first time that Lily went on a horse, she had her left foot totally turned in. She got on the horse, and they took her off and they brought her into the concrete floor, and her first 4 steps were completely straight hipped. It was, we were all just stunned silent. You know, there's a lot of behavior things that the horse solves for Lily. You know, she'll come in here and just be having a really sensory off day. And so it's a motivator.
A couple of major aspects that children enjoy are playing with their friends and feeling good about themselves. With that being said, a study conducted by Frank, McCluskey, and Dole stated that hippotherapy not only may be an effective intervention to improve functional gross motor development, but also can affect perceived self-confidence and social acceptance, which may lead to increases in participation for children with cerebral palsy.
My goal is to be free of use my kids and be able to just use braces.
Another study by Morris, Capote, Angelo, Schiavolani, and David suggested that hippotherapy promotes sensory motor stimulation with neuromuscular and proprioceptive facilitation, and concluded that hippotherapy resulted in significant functional changes and effects on dynamic balance.
And what I've noticed is, one, it's a huge, Maya would not have done anything that she did because she was scared of, but she did it for the love of the horse. Then I learned also that the horse's movement is teaching her brain how to move. And different horses have different gait patterns. So depending on what Maya's needs at that time, Lauren will pick a horse that's appropriate for what Maya needs at that time and what she's working on. So I didn't realize she did not know how to walk. Like her brain did not know how to. So the horse, by her sitting on the horse or standing on the horse like she used to do when she was little, taught her brain what it should feel like to walk. Before she's on the horse, she's bent over and she's tight, like her steps are smaller. Once she gets off the horse, she's a lot straighter, her body's straighter, her legs are straighter, and she's got a much bigger step, like a much bigger step. And a heel-toe pattern too. Actually, she gets the heel-toe pattern when she gets off the horse.
In conclusion, based on the research articles presented, in combination with real stories from real people, it is safe to say that hippotherapy is an appropriate and effective treatment tool that can be used by physical therapists. As the American Hippotherapy Association states, statistically significant outcomes include improvements in patient balance, strength, mobility, gait, sensory processing and regulation, coordination, speech, language, communication, vocal intensity, and participation in daily activities when referring to the benefits of hippotherapy.